Introduction to Nursing Concepts, Medical Terminology, Unit on Comfort, Care, Sleep, and Pain. This is Martha Olson. Sleep apnea is a condition where a person is having difficulty breathing at night. Apnea is actually not breathing. We talked about that in some of the other units. A is a prefix for without or away from. Apnea then is not breathing. Sleep apnea is where a person has an obstruction, usually a person that's obese or has a very thick neck, and you notice a lot of snoring associated with sleep apnea. Another related term to that is somebody that's apneic, and it means that they're not getting enough oxygen because of the lack of breathing. PCA is a abbreviation we use in healthcare. It stands for patient-controlled analgesia. It's a pump that is loaded with a medication. The patient is able to dose themselves with a bolus, meaning they hit the button, it gives them a dose if it's time. It's set up so they can't overdose. Another term that you will need to know for this unit is basal, and that is where the person is getting a small dose of the medication at all times, day and night, and it just runs in, usually pre-programmed. So if they have more pain than what the basal is taking care of, the person can hit the button, get a bolus dose of the medication to help control their pain. This is related to the slide before with the word apnea because narcotics tend to cause respiratory depression, and so narcotics can cause periods of apnea, and the treatment for that is to obviously not give them too much medication, watch respirators, or use the drug that reverses that called Narcan. Tepid is a term that we use in this unit, and tepid kind of means between cool and warm. You like tepid water when you bathe somebody. We see the word tepid when we get the casting materials wet so that it activates the casting when you are going to put a cast on somebody's broken leg or arm. So tepid is kind of a temperature. Stomatitis ends in itis, so we know that that means inflammation or infection. A stoma is actually an opening, and so a stoma could be a mouth, and so somebody that has stomatitis, maybe they have an infection in their mouth. But meaning opening, a stoma can also be like on the colon, where the fecal matter comes out into a bag. You can also have a stoma that empties the urine from the bladder. Other words that end in itis that are important in this unit, glossitis, and that would be inflammation of the tongue. A bed bath can be a partial or a complete. Partial usually means that we wash their hands and face. Maybe we wash under their arms, but it's a very minimal little bath. Sometimes patients request those in the morning early before breakfast when we don't have time to do a complete bath with them, but just to kind of get them freshened up. A complete bath is where you are doing every part of the body, looking at the skin, doing a whole bath for that person, usually once a day on every hospitalized patient, sometimes more than once a day, but a complete bath has changed. We used to use soap and water, and today a complete bath might be done with the little towelettes that get thrown away. A whirlpool is another way that we can give a bath. A patient will be unclothed, and so when you see the prefix un, that means not. Edentulous is another term that you may see in this unit. Edentulous is without, and so dent is teeth, so it's without teeth. Somebody that's edentulous does not have their own teeth. And ous is the suffix at the end of the word, meaning pertaining to. Other words, diaphoretic, dia is a prefix meaning through. Somebody that's diaphoretic, they're very sweaty. We see the word profusely used with that. Somebody that's sweating profusely means sweating a lot. Diarrhea, dia again means through. The loose stool is running through that GI tract and coming out very quickly, and usually meaning very loose or watery. Other words for this unit would be halitosis, meaning bad breath, pediculosis, meaning lice to the head. Xerostoma is a dry mouth. Stoma, you see the stoma word that we talked about earlier. Xero means dry. Cerumen is wax. Dental caries is Dental is in the mouth. The caries is like an infection or a cavity. Alopecia is to be without hair, or to be losing hair, to have a balding pattern. Usually that's associated with men. And inoculation is removal of an eyeball. And people that have a false eye, sometimes that will have to be removed. When we look at the circadian rhythm for the sleep unit, we know that everybody has a circadian rhythm. People that work the night shift will often talk about, their circadian rhythm is off. We look at circadian rhythm with our temperature, our vital signs, because your blood pressure, pulse, and temperature fluctuate with your circadian rhythm. It's slowest at night when you're sleeping, obviously, and you're relaxed. Insomnia is the inability to sleep, so the IN at the beginning of that word is without, so somebody that has insomnia is not able to sleep or having difficulty sleeping. Deprivation, so like sleep deprivation would be not getting enough sleep. I might be sleep deprived because I'm a new mother and the infant isn't sleeping at night. Narcolepsy is falling asleep very quickly at kind of inappropriate times. And nocturia is a term. Noc means night, and you see the word uria at the end. Nocturia is to have to get up and void in the night. When we look at cutaneous stimulation, we know that cutaneous is skin. And when we look at this picture, we see this lady that has a TENS unit on. A TENS unit provides cutaneous stimulation, trying to get the nerves kind of fired up or excited to either cause relaxation. People that go to the chiropractor sometimes get a TENS unit. It helps with pain. I've seen the TENS unit used on patients in the hospital to kind of help control pain post-surgically. When we look at pain, there's several different terms that go with that. Idio is a combining form for unknown. And so somebody that has idiopathic pain, we don't really know the cause of it. We might do a lot of lab tests and other things, but can't really figure out what's causing the pain when it's idiopathic. Pain threshold is how much pain you can have before you feel it, you complain, you go get a pain pill. And then pain tolerance is how much you can take. And people will talk about, I have a very high pain tolerance, meaning I can usually tolerate a lot of pain before it becomes unbearable and I need something to help me with that. These are the terms then that kind of go with this unit for our test, and there will be a quiz on the eCompanion going with this as well. I hope this was helpful and you have a great day. Thank you.